Hey everybody, welcome to WCA Extra. This is our live desk streaming show, kicking off around 9:15, a few minutes late today. Today we are talking all about healthcare. It's a lot of something that's been on a lot of people's minds, especially in the headlines recently, and no other person probably at this time who could talk about that better than Calvin Cutler. So Calvin, first of all, good morning. Thanks for hopping on this morning.
Absolutely. Thanks so much for having me.
And today we're talking about this Oliver Wyman consultant report, basically assessing a lot of some of the problems in Vermont healthcare and what a lot of people, especially in this state, are dealing with. So I guess first things first, really just this urgent message that the healthcare system needs a lot of changes. And no, you and I talked briefly on Monday on a separate story, but we did kind of touch on this as well, and that's basically saying reshuffling the cards here of how and what and where services are in Vermont. So kind of just dive into that for me as far as what they're saying, really what this means as far as the full service hospitals and how services could change.
Yeah, certainly. Thanks, John. I mean, as we spoke the other day, and I don't think it's a secret to many Vermonters that there's a lot of challenges within our healthcare system and how we prioritize and how we fund healthcare. People are getting priced out. Hospital budgets and commercial insurance rates continue to rise year over year. We talked about that earlier this week. And one of the biggest conversations, as we have an aging demographic, as Vermonters are aging, we have baby boomers that, potentially are utilizing more care more frequently in the healthcare system. And that care is becoming more expensive as well. Chronic conditions, heart disease, diabetes, a number of medical procedures that are rather expensive to treat and keep an eye on. It doesn't necessarily make financial sense. And rural hospitals, especially in Vermont, but nationally, continue to lose money. So there was this report which was issued from a key consultant to the Green Mountain Care Board on Wednesday from the consultant out of New York, Oliver Wyman, which really, as you point out, talks about reshuffling the cards and a drastic reimagining of our healthcare system. And I think the biggest feature of it is, either eliminating beds or consolidating beds at Gifford Medical Center, Grace Cottage, Springfield, and North Country hospitals. So those four hospitals, if the Green Mountain Care Board and the Agency of Human Services were to go forward with these recommendations, they would eliminate some inpatient services and instead use those facilities for mental health or for elder care or other, sort of step down facilities to try to, ease what is also a backlog in other places in our healthcare system. Because we've heard a lot about people with mental health challenges, or elder Vermonters looking for places to be discharged, staying in hospitals for days, weeks, months even. So that is in part what they're trying to do with that. But if they go forward with these recommendations, it would be a huge shakeup to our healthcare system.
Absolutely. And I know this system can more almost a compounding issue, and it's been going on for a long time. But for something that, I read in your story this morning too that what kickstarted this? There was one hospital there that really sparked that conversation and said, "Hey, we need to do about some change."
Yeah, and this really compounded before the pandemic. We talked about financial challenges the other day, coming to a head during the pandemic. But it was the Chapter 11 bankruptcy of Springfield back in 2019, which really started this process of soul searching. They were able to refinance their debt and were able to, get their way out of that situation. But across the board, the Green Mountain Care Board started taking a hard look at the finances of hospitals, and they realized that many of our rural hospitals outside of the UVM Health Network, in Burlington, are finishing year over year in the red most years and are losing money. And this report also found that in the next 3 or 4 years, it would take about $700,000 in $700,000 in taxpayer subsidies to keep some of these hospitals going as well. So it was really Springfield that started this soul searching and the deep community conversation that it sparked, because even if your hospital is losing money, these are really important cultural hubs. They're really big economic hubs. They're
Right.
huge employers, especially in places like Newport or Springfield or in Randolph. These are really important institutions in town, and I think that's really part of what's going to make this a very difficult and very painful conversation for many of these communities,
Yeah.
is because when you talk about cutting jobs or closing beds or restructuring, those potentially are jobs on the line too.
Yeah, and that's kind of my kind of shifting into my next point too, is that a part of this report here was a big push for lawmakers to focus on housing. We've talked before about travel nurses and like that, and they're staying in short-term temporary housing, or those fully furnished finders, that kind of thing. And now it's like we need to fix it for a long-term solution and have them live there permanently and work here permanently. So tell me about that a little bit.
Yeah, it's really interesting because this report had a number of recommendations or policy prescriptions for the Green Mountain Care Board, for the Agency of Human Services, for the Scott administration, and for state lawmakers as well. And it basically said for lawmakers, you need to put the pedal to the metal and do anything and everything to try to remove barriers for the construction of housing, affordable housing, but just housing of up and down the income spectrum. Of course, for nurses, for providers, for people that are trying to work in healthcare, but also, as I mentioned, for inpatient mental health or long-term care facilities or nursing homes, places where people would be able to find some sort of housing and not necessarily be boarded in a hallway or in a emergency room or in a hospital bed. And so that was a key recommendation for state lawmakers, was to keep pushing and moving forward with housing. But there were also, of course, other, in addition to restructuring some of the beds, moving forward with housing. There's also continuing with payment reform. We've talked a little bit about sort of the all-payer model and shifting how we pay for healthcare from a fee-for-service to a flat monthly payment or a global budget capitated payment. But that's a different story altogether. But so there was quite a few recommendations in this report. But yeah, one of the big takeaways as well was housing.
Yeah, absolutely. And it looks like the beginning of next session is a lot still just to be done. And then again, as far as just not even aside from healthcare, there's still just the overarching housing problem here in Vermont. So, but Calvin, thanks so much. Again, we'll show this package in just a sec, and we appreciate you shedding some light on this, and of course, some busy days ahead of you, my friend.
Indeed. Thank you so much, John. I really appreciate it.
Thanks so much, Calvin. Again, that was Calvin Cutler, again, just shedding some light on a recent report, consultant report on the state of Vermont's healthcare, with some changes, or potential changes, heading down the pike. We'll pull up his thing in his story, in just a sec here.
After 2 years of community surveys, meetings, and gathering data, Consultants Wednesday painting a picture of a healthcare system in a rural state with a declining demographic in crisis. Cascading healthcare costs are causing insurance premiums to outpace median household income and causing families to skip out on care altogether.
Most hospitals are currently financially unsustainable, and we project by 2028, 13 of the 14 will report even more significant financial losses.
It was the bankruptcy of Springfield Hospital 5 years ago that got the ball rolling on a hard conversation on avoiding future facility closures and trying to find a way to make healthcare affordable for you and your family. So in a major 140-page report issued Wednesday, consultants say state lawmakers need to make housing their number one priority in order to recruit more healthcare providers and bring in more young people to Vermont. They also say hospitals may need to eliminate beds and consolidate services at Gifford Medical Center, Grace Cottage, Springfield, and North Country hospitals, and creating so-called centers of excellence, regional hubs where people can seek specialized services.
Hospitals will need to reconfigure their services and the sites where they deliver them so that more is done away from the inpatient units of the hospital.
This has hospitals urging state officials to proceed with caution, as they say they're also economic hubs.
We're going to be looking at making sure we do no harm to patients.
Mike Del Trecco represents hospitals at the State House and says any decisions should avoid making care more difficult or more expensive to access.
It's too important to get wrong. This is about our friends, families, neighbors, and the vitality of our communities.
As healthcare access and affordability reach a crossroad, difficult decisions are ahead. Governor Phil Scott compares our healthcare problems to our school funding and property tax issues, saying disciplined spending and consolidation will play roles.
There's a bottom line. We can't afford everything. So we need to be smarter and we need to be more efficient in the way we produce services.
A lot to unpack there. Of course, you can read more about that on WCAX.com. And I can, of course, follow a lot of Calvin's coverage as the session quickly approaches. But shifting gears here, Peter, 3 days? 3 days out from the
3
fall.
days out. First day of fall.
First
Sunday.
day of fall.
Yep.
Yes. Certainly is not feeling like that a little bit. I know we're
No.
kind of like a broken record here. I really said that a lot. But I guess a lot of fall activities, a lot of other things.
Yeah.
I've said before, farmers markets, apple orchards, those are all starting into bloom here.
All
which is,
in full swing, and
nice.
you know what? We're going to start to feel like it, too, actually.
Yeah.
Today, really not the case, but again, as we head towards this weekend, it starts to change. For now, the view from Burlington, Newport, Rutland, Linden, showing a few clouds out there, a lot of high, thin clouds, but even just looking out the door here at our WCAX studios in South Burlington, definitely you can see a good amount of gray out there to start off the day. I think we actually develop a bit more sunshine here as we head towards later today. Temperatures out there right now, we've climbed back into the 60s here for most of us. Saranac Lake sitting at 58, Berlin, New Hampshire coming in at 59, and we're going to see these climb back into the upper 70s and low to mid 80s here as we head towards this afternoon. Here is the view on satellite radar. Again, as I mentioned, a few clouds out there right now, especially across the northern half of the area. You can see Burlington, Plattsburgh, Newport all kind of sopped into that cloud cover. I wanted to zoom in and show you this low pressure system off to our south across the coastal portions of southern New England. We were talking about that possibly bringing a few rain showers into our direction here through the course of the day tomorrow, but right now it actually looks like that's going to stay well off to our south and east, but still a chance at a few spotty rain showers here as we head towards the day tomorrow. We'll time it out for you right now. Again, here's how the rest of the day today shapes up. I think we actually see a few more breaks of sunshine really as we head through the second half of the day today. We head into your day on Friday. We start off the day tomorrow, mixture of sunshine and clouds. Notice as we head towards tomorrow afternoon, we start to see a few spotty rain showers here and there, but you can still see all that precipitation way off to our south and east. That's going to stay right there. That reflects in our rain totals as well. Take a look at what Cape Cod and the islands could see. They could pick up 1 to even 2 inches of rain, and then back here locally, we're really not talking about a whole lot of anything. Might as well say up to a quarter of an inch in maybe some locations where we do see some of those spotty showers set up. But again, really for the most part, they're highly isolated hit or miss rain showers that we see Friday and maybe into the first part of the day on Saturday, but still most of us spend the day primarily dry. Those hit or miss rain showers that we are talking about, part of a backdoor cold front that will knock down our temperatures here. So today, upper 70s, low to mid 80s. You notice how they start to fall back into the upper 60s and lower 70s here as we head towards the start of next week. That's also going to come with more dry, crisp air in place. You notice the dew points fall from the 50s and 60s where we are right now back down to the 40s. Once we start talking dew points in the 40s, that's definitely dry, very crisp air in place and fitting here for the first day of fall, which arrives on Sunday. First cellular forecast here for the rest of the day today. Not quite feeling fall-like yet. Daytime highs here for most of us. We'll find our way back into the upper 70s and low to mid 80s out there tonight. Overnight lows, they fall back into the 40s and 50s, mainly clear skies overhead. Again, a few areas of fog starting to develop as we head into tomorrow morning. Through the rest of your day on Friday, temperatures climb back into the mid and upper 70s, a few lower 80s here for daytime highs for your day tomorrow. Sun and clouds again, the chance at a few spotty rain showers here and there, but as we saw, those rain showers, if you see any at all, really not going to amount to all that much. Here's the 7-day forecast. I think probably a bit more cloud cover here as we head into the day on Saturday. Sunday, probably the brighter of the 2 weekend days, and then notice those temperatures here as we head towards the start of next week, John. They're going to fall back into the upper 60s, lower 70s. Keep in mind the average daytime high here for this time of year, 72 degrees, so we're going to start to feel a little bit more appropriate here as we head into next week.
Absolutely. Again, a lot of fun stuff going on. Talk about the Great Vermont Corn Maze this morning.
Yes.
Yeah. When was the last time you were in a corn maze?
I did the Great Vermont Corn Maze just a few weeks ago, actually.
Oh, you did this year?
I did.
Oh, must have glossed over that part. How long did it take you?
4 hours.
Ooh.
We literally have 2 producers over there that are just giving me the looks of like 4 hours.
That's a lot. I think I did one years ago. I don't know. I don't even remember. I don't know. Maybe it's different size. Too.
We have to appreciate it's the largest maze in New England. So
okay. So hopefully. It's nice weather. You're not, if you're stuck in there too long. Then
I've seen the aerial photograph. It's tough this year.
It's tough? Maybe to you. Anyway.
Okay, John, we'll stick you in there alone and see how...
All right. My orienteering skills. Anyway, if you get out for any of that kind of fun stuff this weekend, some still pretty good weather for it.
Yeah, exactly.
Thank you, Peter.
Yep.
Thanks, guys, for watching WCAX Extra. Of course, you can see us again at noon.
Yep.
All of our coverage on WCAX.com and our evening shows all throughout today and this evening.
Yeah.
So that in mind, let you guys go and get after it. So.